Just want to have a candid conversation now about Colorado's COVID-19 picture with Chris Vanderveen, who works on our 9 Wants to Know team, director of our reporting here. Chris, you've followed these numbers day by day and have through the indeterminable length of this pandemic. Colorado is now in what could be described as a third surge, kind of like the rest of the country. One question I get a lot is why? Do we know why or who is driving this?
It's a great question, Kyle. And I think the answer is sort of multi-pronged. There is really no one single solution as to what's going on here. No one single answer as to what's going on here. Some people think it's all related to masks. I don't believe it is. Some people believe it's all related to younger populations, where clearly those younger populations have now, if that's true, and we saw that a few weeks ago, have now led to some infections in some older populations, and that's why you're starting to see a rise in hospitalizations.
One thing that the state of Colorado's public health experts have talked about all along is that this is just a percentage game in terms of getting people to reduce the percentage number of contacts that they have in a day. That if we can reduce contacts by 70%, then this is what our numbers are going to look like. If you can avoid 90% of your contacts. Is it possible that what we're seeing now is just the result of everybody kind of loosening up a little bit and those numbers coming down?
There's a lot of talk right now, Kyle, about fatigue and COVID fatigue. And you can imagine maybe your own family feels it, maybe yourself, you feel it. A lot of people are feeling like we've been through this a very long time. When is this going to end? And this also sort of comes as the beginning of the winter season, the colder season. Everybody knew this was going to come. The question is, when would it start? We clearly have seen it going for a number of weeks now, and because of that, the numbers are really on that upswing, and we want to see when is that upswing going to end.
We're piling up new cases at a rate of better 1,000 a day in Colorado. A lot of that can be explained away through mass testing. That does not explain hospitalizations, which are now well above the 500 mark as well. The last indicator that we've always looked for is how many of those hospitalizations turn into COVID-19 deaths or deaths including COVID-19. So far, no similar spike like we've seen with hospitalizations, and we didn't see it during the second surge over the summer. What do you make of that?
Deaths have stayed remarkably consistent in Colorado for about the last 3 or 4 months, where we're seeing on average 4 to 6 a day. Don't want to downplay that in any way, but it's stayed consistent. I think there is an explanation right now that healthcare, that medicine has gotten better at treating some of the sicker patients. Back in March and April, when this was truly a very novel virus, there was a lot of guessing as to what treatment would work better. We're still not perfect, and there is still no panacea to all of this, but the treatments have gotten better. The doctors, the nurses, they know how to treat those patients better. So there is a hope that we won't see that surge, because we all know deaths lag by 2, 3, 4, 5 weeks after hospitalizations. The question is, will we start to see those deaths increase? The hope is no. But we've got to keep those hospitalization numbers at a reasonable level where the staff can take care of those patients.
Yeah, dig into that a little bit more. The other day in the newsroom, we were talking about this, and I said, boy, it seems like we're getting so much better at treating this based on how hospitalizations are not translating into deaths. And you pointed out to me, watch capacity.
Capacity is huge right now, because when hospitals can treat all those patients, right now we're around, 75–80% of ICU capacity. Obviously, hospitals keep a very high level of ICU capacity because there's other patients in hospitals that are not just COVID patients. But what they don't want to see is where capacity becomes an issue. And you saw this in New York City at the beginning of this, where there were so many cases that there just simply wasn't enough staff to deal with the number of patients. When you have a very sick COVID patient, it's a very labor-intensive process. You've got to have staffing ratios that lead to sort of reasonable care. But when the numbers start to go into a level where they get so full that the ratios start to become problematic, that, I think, is the worry, and that's why you're starting to see hospitals start to gear up, start to build some flexibility in there right now.
If we end up in a situation like we did in the springtime, where capacity in hospitals is strained but not to the breaking point, and the deaths don't come like they did in the spring, for whatever reason we keep the death rate down, is it reasonable to think that there's going to be some kind of public discussion that perhaps we just let this roll, that we do not go into a springtime-like lockdown if we're able, for one reason or another, to prevent the deaths?
That's going to be an interesting tug of war that takes place between sort of the public health side that is going to say we need to do more shutdowns, and the economic side that says if we continue to do these shutdowns, we're going to be in such a position that it's going to be devastating for the economy. So you're going to have that push and pull. You're hearing it now. I suspect under the scenario that you put forth, Kyle, you're going to hear that even more. And the question is, who wins out in all of this? And that's what you're likely to see. There's going to be more pressure for the economic side to win out. We're already seeing that right now. The governor is sort of loath to do anything that is going to treat the state and all of its counties equally. The governor doesn't want to do that because of the potential harms economically. Nobody wants to see that. The question is, the public health side is very vocal as well. And they're saying if we don't get a handle on this, then that number that still keeps going up is going to continue to go up.
Do you get the sense that another statewide shutdown is even on the table as a political and public health reality?
I get asked that a lot, and I don't think so, at least not right now. The appetite for that is incredibly low for obvious reasons. I'm not going to guarantee that it's not going to happen. I just can say right now that everybody is doing everything they can to avoid that possibility. Denver right now is in that level 3 of safer at home. The next level is a shutdown. So the options become less and less numerous the higher you go on that dial. But that's a level that nobody wants to see because they know how devastating. Well, we already know it's devastating right now just simply being in a level 3. I think Denver's mayor was honest about that. But the next level is what we saw back in March and April, where essentially everything shut down. That is not something, I believe, that's on the table right now. Does it mean it won't be? I don't know. I hope not, because I don't think anybody wants to see that.
One thing that I think kind of did a disservice to the public, and we saw this at a lot of different levels, was modeling scenarios based on worst case do-nothing scenarios. We saw when the state of Colorado rolled out its dire projections in the spring of what could happen and how many people could die. The highest numbers that they showed were on a do-nothing scenario, which was not actively being considered. You heard President Trump talk about this in the debate the other night about the lives that he believes that he saved, and he's referring to lives versus a do-nothing scenario. I think everybody knows we're not going to do nothing. Do you feel like public trust has come back from that point? Do you feel like the modeling now is more realistic, or are we still kind of tilting at this do-nothing scenario?
I mean, you're still seeing a little bit of the do-nothing scenario. I can say the models that the governor is looking at, that Dr. Salmon is putting forth in the state of Colorado, there's still plenty of doom and gloom scenarios that are out there. Now, we haven't seen many of those doom and gloom scenarios come to be, and I think that has eroded some of the trust that people have, particularly with people that don't understand the purposes of modeling. Modeling isn't necessarily sort of put together a worst-case scenario. I think some of us in the press have been more than willing to sort of offer those models as worst-case scenarios to try to scare the heck out of people. That's not great journalism, by the way. But in the meantime, those models are sort of a guidepost of what could happen. Problem is that they've been coming out for so many months, and some of those scenarios, even under the social distancing time, the issues that we're seeing right now, some of those social distancing numbers, you're not seeing those models come to bear. And there are, I mean, talk about, you know more than anybody, there's plenty of skeptical people out there, and I wouldn't say that the skeptics are losing out right now. I think they're winning.
Last question, as it relates to masks. We see situations where there are parts of Colorado that have pretty impressive rates of mask wearing and have also seen spikes in the numbers. And what I can't wrap my head around is that indicative of the fact that mask wearing, at least the way that we're doing it, is not as effective as public health experts had hoped? Or is it that even if you get 85–90% mask wearing, having 10 to 15% of the population refusing to wear masks is enough to spin up cases?
Well, Kyle, I think there's a fundamental misunderstanding of just how effective a mask can be. You wearing a mask around somebody infected and being in close proximity to that person and spending a lot of time around that person, that mask offers you no guarantee that you're not going to get sick. And I think that's part of the problem. We have built up this idea that masks work all of the time. And anybody who works in public health knows that's not the scenario that they're putting out, that masks sometimes don't work. But what they do is slow the rate of spread so that your chances of getting infected when you're in that room with somebody who's infected go down, if ever so slightly. We treat everybody, what's interesting about public health right now in COVID is that we treat everybody as a mathematical equation, which sort of boils down to that, where we're just strictly a number and percentages, and masks bring that percentage of getting infected down. Now, it doesn't bring it down to 0%, but it brings it down. What's interesting is that you saw in Adams County is hovering around 90% mask use according to Tri-County's health data. And yet their cases are going through the roof. So something else is going on here beyond just masks. And I think it's critical for people to understand. Does it mean that I'm telling people not to wear masks? Absolutely not. But what it does mean is if you're expecting from masks alone to be the solution here, you're going to be awfully disappointed.
Yeah, if masks alone worked, then we wouldn't have ever lost any healthcare workers along the way. Lastly, Chris, what would you encourage people to just keep in mind as we move forward into these next couple of weeks?
There is going to be a temptation, particularly in November and December, to be with groups of people. That is historically how we've spent it. And you just have to realize that if you look at us as a mathematical equation, if you boil it down to just numbers, the odds of you getting infected go up because you're hanging around more people. It's as simple as that. It's no more complex than that. And in Colorado right now, there is the rate of spread that indicates that the chances of you being in a room with an infected person have now just gone up. 2 months ago, the chances of you being in a room with somebody infected were way down. Right now, it's way up. And so you have to ask yourself, what things are worth it in your life to keep yourself and your family safe? You have to ask yourself that on a daily basis. Does it mean you make stupid decisions? No. Does it mean that you sort of take risks? Hopefully not. But you have to look at it from that individual basis, and what risks are you prepared to take? I'm personally not going to be taking a lot of risks because I know what's out there. The virus is out there in large numbers that we have not seen in Colorado in many, many months.
All right, Chris Vanderveen, appreciate your perspective on this and for taking the time to walk through all this. We'll talk again soon.
You bet.